We're live. Hi, everyone. Happy Friday. My name is Miranda Romanowicz. I'm the CEO of the Ontario PSW Association and host of PSW Podcast, where we come live to you guys here on Facebook every single Friday at 11 a.m., where we talk about important topics relating to personal support workers. Sometimes it gets a bit crazy, sometimes it gets a bit serious, but at the end of the day, we're just spilling the tea when it comes to PSWs here live on Facebook. Today, I'm joined by, as you guys all well know him, DaSilva, my Chief Operating Officer, and we're here to talk about the importance of insurance, professional liability insurance, medical malpractice insurance, whatever you want to call it. And starting out your career as a PSW is where we're going to get started, and why it's important for students to know this, but also for PSWs in general to know the importance. We've had a lot of questions, hey Ian, over the course of the
Absolutely.
last little while that just that just have made us do this podcast. We
Yeah.
changed what we were supposed to do to this podcast today. So, Ian, let's talk a bit about insurance. Now, we have
Sure.
lots of PSWs that are coming out into the field. Over the last 2 years, we've had over 25,000 new personal support workers join the field, and we're proud of that. But, why insurance? Like so many PSWs even fight back on stuff that we tell them about
Yeah.
insurance. It blows my mind, by the way.
It's a big problem, and we see it regularly when we say you need to have professional liability insurance, like the nurses and doctors. Everyone else on your health team has the same insurance. Yet when we recommend this to frontline healthcare workers, like personal support workers, a lot of hostility comes in, believing that they actually have this insurance and it's not needed. So, the goal of today is to dispel these myths,
Yes.
or at least work to deal with this, because there's a lot of misleading information being circulated to staff by all employers, not negatively, just by, I think, unknownness, I'll say.
Yeah. So people that think they know, like I say, like they heard it from their cousins, uncles, fishes, babysitter's friend, that this was the case and that PSWs don't need liability insurance. When in actuality, liability insurance is super important for a PSW. It's like I always say, doctors and nurses have medical malpractice liability insurance. They have to have it for the just in case. It's like, when we started this whole, liability insurance going back over 10 years ago, I had PSWs ask me about it when I was standing in front of a class full of them. And I said, well, it's like you don't get car insurance anticipating that you're going to leave school, go to Timmy's, go into the drive through and you're in somebody. It's the what if something happens. And I can tell you guys from a point of being in the leadership of the association where we deal with PSWs and their issues on the daily, there's a lot of things that can happen. Never say never,
Never
right?
say never.
Never say
Absolutely not.
never. Yeah.
So I think what we want to do is we want to start dispelling some of the myths. So we're going to be using a bulletin that we've been circulating online. And do you want me to start to some myths?
Yes. Let's
Okay.
talk about each point. Let's
Yeah, let's talk about each one.
flush it out.
Okay.
Yes.
So one of the risks to personal support workers who rely on employer coverage. So this is all of you out there who are all of you who are working for employers, you're full time, you have that union card, you're good. You believe you're safe as houses. So we're going to start dispelling that. So sorry, we're going to get some anger out there. We know this is coming. So basically, the employer's limits of insurance and types of coverage will vary by employer, and employers may not have enough to limit or defend both the employee and the company in the event of a lawsuit. So what does that mean? And I've said this 1,000 times. If a PSW gets sued and they are in their belief and they believe in their hearts that they have this insurance through their employer has to make a choice. If they're sued, do they defend the company and all their employers, or do they defend you? They will defend the company. If you don't believe me, if your employer told you otherwise, they are lying to you. No company in their right mind would sacrifice an entire company for one person. It will never be done. If they're telling you that, you're way gullible. No offense, but you are. So you've got to break that right now.
Yeah. And we hear that all the time.
All the time.
Like all the time. Like we'll put out things about insurance, we'll talk about it, and we have all these PSWs that say, "Well,
Yeah,
my employer will cover me. They will protect me." No, they won't.
it will not.
And we have seen it countless times. And I'm talking, that's why we get kind of, flabbergasted, I guess is the word, because we see so many people, PSWs going through this. And then, God forbid, something does happen. How many of them, Ian, come knocking on our door as soon
All of
as
them,
they've been charged.
and all of them, right away.
All of them. Yeah, without
Trying, we
fail.
believed in our employer, they had my back, now I'm in a jail cell. What am I gonna do? Well, where's your insurance? I don't have it. Are you a member? No. There's nothing we can do. You're on your own. Have a great life. It's that
No.
simple.
Yep.
Sad, but that's the reality of healthcare delivery in Ontario. So really want to shout out to any other colleges that promote this membership and this insurance. So the other side of this is that employers coverage will not provide any coverage to members if you're contractors. So when for those PSWs out there who are working full time and you have your insurance, you're you're not safe. But if you're a contractor and you're working for an agency and you're working independently and you're doing all that type of thing and you have all the forms signed and you don't have insurance, you're placing everything you have up basically for litigation. You're potentially risking everything you own at that point. So as a contractor, as an agency worker, if you do not have your own professional liability insurance, you don't have to get it from OPSWA. You just need to get it. You're really taking in a very silly risk. Like I can't put it another way. It's beyond me why you would proceed in this regard.
So Ian, let me ask you this question then. So let's break it down even more.
Sure.
So what, because you say you could lose everything and you could be up for litigation. So what does that mean?
So, okay, for example, I'm a PSW, I have no insurance. I walk into a house and I cause an injury. Okay, like I spill oil and the house catches fire or something like that, or I injure the person. Okay,
By accident, doesn't
by
matter.
accident. Okay, so under
Okay.
law, you under civil tort, which or this would fall under, the person whose house was burned could sue you as the person who caused the accident to happen, and say you need to basically build me a new house and you need to find the money somehow and we'll make sure that we seize your assets to compensate us. This is not takes a long time to do this, but it can be done. So you could be on the hook for owing someone huge amounts of damages that are well beyond your ability to pay. So you're looking at immediate bankruptcy. It's a lot of risk again, just to do the home care. So that's an excellent question. You're in and out, and you assume you're safe. You assume someone has your back. You do not. So they do not unless you're a member or you have your own professional liability insurance. But yeah, that's the case, Marion, is how you can lose everything. It's that
Literally, yeah, you can literally lose everything. And again, I'm going to tell the same story that we told a few weeks ago on this podcast. We talked about a PSW that was not a member of the association that was charged with abuse. She was innocent. She did not abuse this resident. However, she had to go through the entire court process. That, because she was not a member of OPSWA, put her family and her into $70,000 in debt. Trial and lawyers are not cheap. Like, and you're gonna have to defend yourself. You don't have a choice if you want to save face and and support yourself. You have to defend yourself somehow. So yes, it's very, very, very important that you have this liability. Let's go on to the next one.
well, there's actually a question. I mean, I just want to break because I think we did it a bit. So there's some confusion about, I guess, what the total package is from OPSWA. So Miranda, explain what it is. I join OPSWA. There is obviously some confusion about joining OPSWA and am I insured if I join OPSWA? Now, Miranda.
So, I mean, every single member of the Ontario Personal Support Workers Association is fully covered by liability insurance, your own individual liability insurance. So, when you join as a PSW member, you get your badge that identifies you as a PSW and shows that you're verified from OPSWA as a PSW. You get your $2 million professional liability insurance. And I believe 50,000 abuse coverage. So those two together are like the dynamite in liability. Okay. They're absolutely fantastic. You get all of that. That is always included. The different membership types do hold different levels necessarily of liability insurance. However, every single membership has liability insurance. You can't run from it if you're an OPSWA member.
No,
It's
I don't.
embedded in your membership.
So I guess we should have started off by Marina by saying this webinar does not necessarily apply to OPSWA members. If you're an OPSWA member, you have nothing to worry about. This webinar does not apply to you. So those of
Exactly.
you who have the OPSWA card out there, you're good. You're safe. You're good. You're
You're
done.
safe, you're good. And if you have questions,
You,
always know that we're here.
yes.
Yep.
So, and also please remember, if you're going to get insurance from somewhere else, you're going to have to pay out of pocket. It's going to be several times what we charge, and it is not tax deductible the way ours is. So I can't make this a no brainer more than I can. So
Right?
Yeah.
I know. I think we had one PSW that came to us and she actually switched over to our insurance because she was being charged $900 a year for her personal liability and professional liability insurance. And she came over to us and she paid, the 209 for the year.
For the year, and that included everything. And and on the private insurance, there is generally a deductibility. So deductibles, when it comes to insurance, is the amount that you have to that they don't cover you for the first amount of damage. So for a lot of private insurance, it's $1,000 deductible. So if you have a damage and you cause $2,000 worth of damage, you don't get that first thousand. You only get the $1,000 back. So that's what deductibles are. We don't have that at all. So no need for OPSWA members. Again, this does not apply to you. You do not need to worry. It's only the non-OPSWA members on here that we're targeting today. So
Absolutely. And to dispel the myths.
dispel the myths, because we get this a lot, and it's there's a lot of important things here that we're going to get into. Please go ahead.
They fight us.
I know.
So I'm speaking directly to those PSWs. You guys know who I'm talking to. We tell you that this insurance, you're not covered by your employer. If there's a class action suit, if something happens on the floor in long-term care, if something happens on the floor in retirement, if something happens in someone's home in home care, community care, etc., your employer is going to protect the company. You will very quickly be thrown underneath the bus because you are one person. So don't inflate your importance to that fact. Protect yourself.
Nurses don't inflate their importance to the point where they refuse insurance. Doctors do not inflate their importance to the point where they need insurance. Surgeons, no. We only seem to be getting it from PSWs, and this is very much something that we need to got ahead.
Ernie?
You guys?
Yeah. Yeah. Because I know that a lot of them will get told by employers or their union that they don't need professional liability insurance because they don't want them to join our association for some odd reason. You really got to think about that one. And we're not saying you guys have to join OPSWA. We're saying you need to protect yourself. That's what angers us the most. As I am a PSW myself. I couldn't imagine going out and doing care without having liability insurance. I could lose everything. So I really want them to sit back and think about that. So Ian, what was the next thing that was on there from our
There's a
insurance?
couple more bulletins that we want to cover. The next one is a little bit more confusing, and this is about employer timelines. Again, employers, we're not trying to attack employers. Think of an employer as a passive entity that will automatically protect itself instinctively. Okay, so it's not good or bad. This is more of an instinct reaction by employers. So just deal with that. But if an employer makes a mistake, they don't file a report or a claim in a certain timeline, then what could happen is that there could be no coverage in the future. So if you discovered that you had an injury if you were working for an employer and you caused some sort of injury and that injury wasn't discovered until a year later, for example, suddenly you realize you had a back problem or the patient did, and you realize that it came from a certain incident a year prior, if the employer didn't report that, you're out of luck. That means you don't get coverage. You just have to deal with it for the rest of your life, and you're on your own. Or WSIB, again, you're on your own. That's a little bit more of a niche one. But the next one is really important, is that as members of our association, your insurance covers you 24 hours a day, 7 days a week. If you are relying only on your employer, again, it is a silly thing to rely only on your employer for insurance. Okay, you do need to take this responsibility. If a member is in a situation outside of their employment that required you to perform medical care, so let's just say you were on the side of a road and an accident happened and you did something, your employer doesn't care. And if you cause yourself injury and you lost your job, you were out of luck.
Well, how many PSWs does that happen to? I mean,
All the time.
Nicole and I have talked about that numerous times where suddenly we're driving down the road, in my past and Nicole's had more recently, where suddenly we see an accident occur. It's almost like our sworn duty. Got to get out of the car and see if everybody's okay. It's just something that's embedded in us. As a PSW without insurance, you could be sued for doing that. But if you have insurance,
Absolutely.
it's called the what's it called again? It says it on there. It says it's called a Good Samaritan Act. So it's our insurance is covered by the Good Samaritan Act. So by doing something like that, then you're covered. Your employer ain't going to give two tiddly doos what you're doing when you're outside of work. What if you're walking through a grocery store and an elderly lady falls and you help her up and the family gets mad at you because on the way up something happens that you don't mean for it to happen and that family targets you? Your employer is not going to assist you.
The employer will be mad because they want you to be healthy for them. And now you've taken a risk that they have to pay for now. Don't expect to be treated like a hero. Just don't always expect to be treated like a hero. It's because that's not how it's been set up.
No, no.
So that's a good point, and thank you. That's so the Good Samaritan thing is important. We as healthcare workers think that we need to participate, which is fine. If you're an OPSWA member, help your go nuts.
I was
Absolutely be out there.
thrilled with that because
You're good.
our
Yeah.
last insurance broker did not have the Good Samaritan Act. This one, there is a Good Samaritan Act. So PSWs, OPSWA, PSWs, make sure to help whoever you want to help because, there's not enough good ones out there. So go for it.
So the last 2 points that we wanted to bring up to attention today is regarding the changes that are coming down in Ontario specifically and across all of Canada right now is the move towards the regulation of the personal support worker. So we have a lot of members that are always requesting this. We do know it's coming. It is slow, it is glacial, but it is happening. This is going to impact every single personal support worker right across Ontario, and it's eventually going to impact everyone across Canada as these regulations become harmonized. Um, as a result, if, for example, you become when you are asked, and you will be in time to register with the Health Services Care Providers Oversight Authority, that's a public registry. Once your name is on that registry, if you get a complaint against you, okay, so if someone in your community complains against you and you're listed on the new public provincial registry, you need to defend yourself. Your employer will not, under their current insurance, provide you with any assistance. Their insurance does not cover you if you're being challenged by the HESCAPOA, and they also will not provide you with a lawyer.
No.
So, as a part of your professional responsibility now, PSWs, there will be an expectation that you do need to take some personal accountability for being a PSW. And this is, believe it or not, going to be a good thing because it will make the profession standardized and make sure those who actually should be PSWs are PSWs. So, right track, but please understand that once you register for the HSCPOA, you really, really, really should be joining your professional association in tandem, and likewise, vice versa. It's important to be a part of this. It's important to be a part of a transparent system, and that's what we believe in.
We're health system partners.
Your health system.
So HESCAPOA plays into us, and we play into HESCAPOA. That's just the way it works. And it's really important that you guys understand that this is no longer a fly by night little thing. The personal support worker has matured to the point of pseudo regulation in the province of Ontario, and it's expanding across Canada. We are being taken very seriously at all levels of government, regardless if you guys feel it or not. This has been a battle that I myself have been a part of for over 15 years. Ian's been a part of it for a very long time, and this is wonderful news. But the onus will land on you guys. So you guys are going to really have to pull up those scrub pants. I don't want to say something else, but I'm not going to say it. Pull up your scrub pants and take yourselves seriously. This is a very serious career. The PSW provides the most intimate care to our most vulnerable in Ontario. And a lot of us go into homes where, I mean, it is a very trustworthy profession. It is something that not just everybody can do. It's a very difficult job. But in order for us to be taken even more seriously, and for us to make, and I'm going to throw out the money thing, if you guys want to make more money and you guys want to be taken more seriously, it starts with professionalizing yourselves. And that is getting insurance. You need to ensure that you have the proper insurance, that you maintain your certifications, and that you join your professional association and the public registry, because that just means that you take yourself seriously. Just like nurses. Nurses are a part of obviously the College of Nurses. They're part of the RNAO or we RPN because of insurance purposes. And so it's an important, it's kind of like we encompass you guys. So, the HESCAPOA is there to protect the public. Rightfully so. OPSWA is there to protect the PSW. That is our everything, is that we protect you guys. So you got to make sure that you take yourself seriously enough as a PSW. And you know what? And guys, if you want to go on to nursing, go on to nursing, be wonderful. I don't care. But as you're working as a PSW, you really need to take that profession seriously and take responsibility for it.
And if I could just add, if I can add to that, especially for those of you who are looking to go into nursing, the best thing you can do is make sure you're a part of a professional association and understand the role that that professional association will play in your professional development going forward. Because once you become, if you're a PSW and you're looking to become go into the RPN and RN, that's wonderful. But you're going to be expected to have your own insurance, and you won't be able to get employed without it, as it's part of the government requirements. So It's a very good experience to learn. It shows you how to follow a code of conduct. It is very important to be a part of your professional association, especially if you're looking to go into nursing, for
Be
sure.
proud.
But
Be
yeah,
proud. I mean, being a PSW is not an easy gig. Been there, done that. And it was not easy. And I have the scars to prove it. But I will tell you guys something, that the maturity of the PSW reaching this level is phenomenal. Because I'm telling you, when I became a PSW in 2006, Ian, nobody knew what the heck a PSW was. And even still to this day, we still have randos that, they don't know what a PSW is because they all think we're nurses. And I get that. But be proud of that title, because no one is just a PSW. We are a foundation to the healthcare system in Ontario.
and that sets us up for what the next topic should be about how does and then that's how we become part of that interprofessional health team. Why we need to be included in the discussions about patient care and director of care assessments. They're not. PSWs are not included. And I think that comes down a lot as PSWs. Well, we've been working to make sure that the profile raises so that PSW's opinions, and at the end of the day, the PSW's opinions and observations are those of the patient. So when you're really looking at trying to really do in real terms patient-centered focused care, that patient deserves to
PSW.
have an insured professional member of the society protecting them, but they're also relying on that person to communicate to the professional health team. And the PSW is often
PSW.
not included.
Often, 90% of the
I'm being
time.
polite.
I know you are. I'm just being blunt. 90% of the time, the PSW is not included in any of that stuff. There are some homes that do that. Like
Yeah,
when I worked in a long-term care home, it was hilarious because when the doctor used to come in to do rounds with his patients, and this is going back because doctors don't really do that anymore, but he'd come in to do rounds with some of the patients, and he'd take a PSW with him. He didn't take a nurse, he took a PSW because he was like, you guys are with them all the time,
which is
you know?
and the role of nursing has changed. So the patient observation element is becoming more important to you, and you're going to become more reliant in the future as being a part of that team. Um,
We do
yeah,
have a question though. A question came in.
of course.
So what if I had insurance but it has run out? Easy peasy, Marianne. All you got to do is rejoin the association.
Yeah,
You just rejoin the association. For PSW members, it's 19.99 a month plus tax, or 209 taxes included for the year. And you guys get a badge, you get your insurance, you get everything you could possibly need. It's important to have it because I don't, what breaks my heart is when Ian and I have to have these conversations with PSWs that are not members of our association because they just don't see a point to it, which is fine. That's their
fine,
right.
it's
It's a
fine.
diplomatic society, totally cool. But then they come climbing up into our window late at night when something's gone wrong
Yeah,
because there's nobody else that can support them but the association. So just keep that in mind, please. Please. I'm not forcing you guys to join.
we will help. We'll do our best to support you, but understand also we can't do a lot for people who are not members of the association. So I mean, we get a lot of requests for people asking for advocacy, employment supports. But again, we are a professional association, so we would require people to be a part of this growing community so that we can verify that they're actually PSWs. And this is what you all should be wanting is that standardization of your role and taking yourself seriously, which is
You guys have to remember too that we have our mandate and we're also covered by our own insurance. And if you're not a member of the association, I technically cannot touch you with a 10-foot pole because you're not covered by insurance, you're not a member. So and it's heartbreaking. It breaks my heart all the time.
it's
It really does. And it's just, just to have some semblance of calm and safety would cost you 19.99 a month.
yeah, it is
And
an
pay
open.
more for your cell phone.
And that 19.99 a month is tax deductible. So you don't pay taxes on that at all. You get it all back at the end of the year when you're doing your calculations. So again, it's not a we understand that sometimes financial flexibility is very tight right now, but it can become a lot tighter a lot faster with
Yeah.
a warning. Um,
Well, I really hope we didn't freak everybody out
yeah,
today, because I
let's
mean, we really went down like the dark, Alice in Wonderland hole here, and there was no bunny at the end. And but we just wanted to just be blunt as we always are.
disagree.
We're known for being blunt and transparent and honest with you guys, and really putting out there, you know, the real deal here, guys. There's no fairy tale happening here. It's the real deal, and you guys are taking care of society's most vulnerable individuals, and you got to protect yourself. And we want to help you protect yourself. So, Ian, we're going really late into this.
We have to jump
So
off.
we have
Yes.
to jump off. We actually have a meeting after this right away. But anyways, thank you so much, everyone, for joining us again today on PSW Podcast. Remember, there's going to be clips coming out next week. And of course, next Friday, we'll see you again here on PSW Podcast. And with that, I'm going to say, OPSWA out.